physician. So today we're going to be taking on the social media perspective with Dr. Suzanne Soliman. So thank you again, Dr. Soliman, so much for joining us. And then for all of our guests attending, if you can just fill out the quick pre-discussion survey, we just posted it in the chat, only takes a few seconds. And so without further ado, I wanted to introduce Dr. Soliman. So she graduated with the PharmD from UICCOP here and went on to pursue a primary care residency with emphasis on education with Midwestern University. She then went on to also pursue a public health degree with Harvard University, and then later came back to the UIC College of Medicine for a teaching and scholarship fellowship. Dr. Soliman is currently an adjunct assistant professor at Rutgers University and St. John's University College of Pharmacy and Health Sciences. She currently holds the position of Chief Academic Officer at the Accreditation Council for Medical Affairs and is the founder of Pharmacist Moms. So Dr. Soliman is a speaker and medical contributor on various pharmacy topics, and she's been quoted in the New York Magazine, Crain's Chicago Business Magazine, Time Out Chicago, The Daily Voice, and then recently the Pharmacist Times as well. So we have a few questions prepared, and then also for the audience, if any questions come up, please address them in the chat, and then we'll kind of get to them as we kind of go through. So our first question, Dr. Soliman, so how have you seen the intersection of social media and the healthcare change within the last couple of years? And then where do you think you fit in, specifically also with Pharmacist Moms?
So I thought this question was interesting because social media has really changed. If we go back even more than just a couple of years, people initially were just using Facebook, to connect with old friends or with current friends, and it's really changed now to become more of a news source. So even within the last couple of years, I would say that there's a lot more medical information out there that you can find via social media. And I think I talked about this when I presented recently at UIC, but a lot of people get the majority of their news from social media. So they're not actually going on to the news. They're not going on to logging into the, watching TV. They're actually just going on their feed, and what someone else might have shared, they're reading it through there. So it could still be from CNN or NBC. But I really think that it's really just changed the landscape, to what we see, because you get this news feed when you log into your LinkedIn or your Facebook and you see what's in there. And so it's very different than previously, when social media is really just used to connect others or maybe to chat. So it's really changed. And the other part is that with patients, I think that what's happened too is that patients have embraced social media. Patients are on social media. They're looking things up. They're looking up, different diseases or medications. And, really what's great about social media is that basically it makes all unheard voices become public. So any voice that someone has, you can, get your voice out there. And I think that's the most important part of it. Where do I think I fit in particular, or I guess just me, myself, or my organization? I think, I'll speak on behalf of Pharmacist Moms. We are the largest group of pharmacists now in the country. Our voice is very large. We've worked now with the state of Virginia to get provider status for pharmacists. So we're really working now to utilize our voice as 35,000 women, women pharmacists. So we're really trying to do that. We put together a little video about women who were standing all day at their chain pharmacy and didn't have access to stools, and a chain in the Midwest responded to us, and they are now providing stools for all of their pharmacists. So I think that, in my opinion, social media has really allowed us to embrace our profession and let other people know about it and learn from it. So I think that I really believe in social media, and I do think it works.
So I think this kind of takes us to sort of our second question, kind of tying this social media with the COVID pandemic. So you know, considering everybody can have this voice that can be heard, that can be both good and dangerous amidst this pandemic. So from your perspective, what are some of the benefits and then challenges of social media and kind of spreading different information about COVID?
So I can tell you that one of the biggest challenges that I've encountered managing a group of 35,000 professional women is that not everybody agrees with what's going on with COVID. So, you know, some people are in the boat that we should have more restrictions. We should, you know, close everything and, you know, embrace social distancing. And there are many others who are not in that pool. I would say they are the minority, but they're there. So some of the challenges on social media is when they begin to, you know, write comments to each other that are unprofessional. So I think that that's a big issue. I think that there is information that spreads. You know, Facebook has been really great, and YouTube about taking posts down that were inaccurate. We've tried to do that as well as administrators of large groups, but you know, there are different conspiracy theories circulating, and you know, we have to be able to filter them, I guess. You know, so right now there are filters. So on all of the groups, so certain topics aren't being able to be shared, especially related to the conspiracies and things like that. So I think that's one of the challenges, you know, that everyone has a different opinion, and that if you're trying to get everyone together, that sometimes it's difficult for everyone to see eye to eye. What I do think is that, you know, is really beneficial is that we have to realize that our patients, you know, everyone, our neighbors, our family members, you know, everybody goes online. Everybody's using quote unquote Dr. Google, or, you know, they're looking up things on the internet. And, you know, and I think that we have to really be able to earn the trust of our patients or our families related to COVID. And I think one of the things to do, one of the benefits, is to really become human. And I talked about this in my previous campaign, but I think the link between humanism is really important. So, you know, putting on a mask and taking a picture and showing what you have to deal with as a pharmacist, you know, whether you're in a hospital or you're working in a community setting, you know, showing up. We had one picture of a group of pharmacists and their technicians outside, and they were doing COVID testing. It went viral. I mean, you know, within a day I had over, you know, I want to say like 40,000 views or something on that photo. And it was just a photo of a pharmacist in a parking lot. But Alicia Keys' photo of one of the pharmacists out here in New York, you know, it was great when she did her song, and she had a pharmacist in the photo. So I think there are a lot of benefits to using social media, to showing what's really going on. Twitter actually reopened their verification status at the time, so to get the blue check mark next to your name for any physicians who are working live, you know, in the trenches. So I think that's really important as well.
So, you know, I think you sort of touched on this a little bit, and I know you were also recently quoted in the Pharmacy Times article that kind of talks about the power of social media amidst this. So, you know, and how are you also positively using Pharmacist Moms to spread accurate information? You know, I know you said kind of promoting like different pictures and stuff like that. And so is there anything you're also further doing to kind of spread the accuracy also of all this information, all these data that's out there as well?
So initially, when a lot of the community pharmacists were not protected and there was no plexiglass up, we had pharmacists in our group. We had a few that were in Italy, and they shared photos of us with me and with us of what they did. So I was able to share, you know, a lot of them just had plastic. We even had a pharmacy in Poland, you know, send us a picture where they had all plastic covering the entire pharmacist area, like the space where the pharmacist stands. So I think that was one way. You know, we also put together some guidelines. The Pharmacist Moms group created guidelines with some really top key pharmacists, influencers, on what pharmacists in the community should do. This was before, you know, this was in early March, where it was still unclear what needed to be done. And so I think that, it can be used positively. Another example is one time we had a pharmacist in our group say, guess what just happened? Everyone, I need to warn everybody. I had a patient just coming in right to my pharmacy and said, I think I have COVID. What should I do? And she's like, so now I made signs and they said, if you think you have COVID, and she hung them up outside, the door, don't come in here, call us. So I think being able to provide the information really quickly, and then we posted that also went viral, where a lot of pharmacists saw it, and it was like, hey, you know what, we need to be aware of this. This is going to happen. And, this didn't happen to you yet, but it could happen. Someone can walk into your pharmacy. So I think that's where we can really help each other. It can be used positively during this time. I think that's key. I think the other thing is right now with the masks and, testing, people have a lot of questions. Pharmacists are like, well, is this accurate? Are there saliva tests and this and this? There are so many questions. So I think that we're able to provide more accurate information that way, with a lot of the testing and protection as well, protective gear.
Yeah, no, that makes sense. So our next question is, what experiences have you had with this pandemic utilizing your social media presence to advocate for the pharmacy profession? I know, again, I kind of talked about the pharmacist times you were kind of quoting that it seemed like that was like a big platform for you also to kind of utilize this Pharmacist Moms presence. And so have you had any kind of other experiences with that?
Yeah, I mean, I was quoted in New York Times as well about different things as well. So Pharmacist Moms is definitely, buzzed around. So we're able to help. I think that one of the biggest things, this was pre-COVID, this was right before, back in February when I was quoted. And it was more about the number of hours pharmacists are working in chain pharmacies, how they're not getting breaks and lunches. And we were really able to put out a voice for pharmacists related to that. I think that we can begin to advocate further as well, with the COVID. Again, I think it's really important that patients are aware, like you don't just go to your pharmacy and walk right in and, because a lot of them, when they're sick, that's the first place they're going to go is, hey, I'm going to try something over the counter. But really now to call the pharmacist, talk to the pharmacist over the phone, that's really important. So I think that talking about what we can do is also important. So the first part is really just showing, how to help other pharmacists. But the second part is, now that pharmacists in many states are able to provide COVID testing, linking that back to provider status. And that's what we're working on right now. We're working with various organizations to help promote provider status for pharmacists, which should have happened a long time ago. Since I graduated pharmacy school, we've been talking about provider status, but I think that actually this is going to help propel and move everything forward for our profession. That's my personal belief. So I'm really going to try to use the voice of Pharmacist Moms to move our profession in the right direction.
So the next question kind of, as an influencer, you might have encountered verbal abuse from random strangers, and how do you handle a situation like that? And then have you encountered this particularly on your Facebook page on Pharmacist Moms during the pandemic as well?
Wow, very okay. So this is a great question. Yes, I've encountered verbal abuse from random strangers. There have been women in our group who act unprofessionally, and sometimes we have to remove them. And then that's when sometimes I'm harassed personally or my family is harassed. So I've encountered things like that, or women who will go and say, oh, I'm going to go open my own group and things like that, and just kind of bash me or my family in there within their group. So that has occurred. There's been instances on Instagram where people will just reach out and they can call you. I didn't realize that could happen. So I just block everybody from calling. So, they could do some sort of video call or something. So definitely it's scary sometimes. So you have to protect yourself. You have to, just be aware of what's going on. You know, and even with the people who have been removed from a group, sometimes I wasn't even involved. I have 8 administrators who also work on, you know, removing people and all of that. And sometimes I'm still the one to get blamed. So it's you know, it's fine. I now I don't take it as personally. Initially, I was taking it very personally, and it was hard for me. But now I've gotten a little bit better with that. But it's hard. I think initially it was very hard. I was taking everything very, very personally. During the COVID pandemic, yes, I have gotten, not me in particular, but there are pharmacists out there who, some of them believe that, you know, the conspiracy theories might be true. Those are, again, in the minority. So then I have the other pharmacists who are coming to me, asking me to help them to kind of work to change people's opinions and things like that. So then I kind of step back and I'm, you know, I don't want to get involved in a lot of the political drama as well. So definitely there's a lot of politics and like political drama with COVID in particular. So I think, you know, just trying to remain professional as much as possible is critical. I think, you know, as an influencer or as any professional representing yourself or your profession, the most important thing is to remain professional. And I think that's my best advice that I could also give is just, you know, remain professional in any situation like that. I don't discuss politics. I don't discuss my political views. I think that, you know, that's personal, and I think that's separate from what I do.
Sure. And then sort of our kind of last question to tie everything together. So do you have any advice for student pharmacists who are listening to us on how they can utilize their social media platforms to promote healthcare, particularly during this pandemic?
Yeah, definitely. I think one of the biggest things is just to talk about what you're doing. I think the more real you are, you know, talking about how stressful school is, if you're, you know, a P1 or P2 and you're, you know, on Zoom calls all day and you're trying to adjust to that, and you're in a group and one person in your group isn't participating and 2 other people are doing all the work. I mean, I think the more real you can be, the more well received it is on social media. I always go back to this example for myself, but my first photo that actually had the most likes was my kids. So basically I dropped them off at school at daycare, and then their car seats, the 2 of them, my car was a mess. It was just so dirty. So like I took a picture of my dirty car, and I was just like, can someone help me? Because my car is filthy. And that had the most likes because I think it was just real. It was like, you know what, I'm not going to pretend that my car is clean. It's not clean. It's never going to be clean. I've accepted that I don't have a clean car. You know, maybe when my kids are older one day I will, but, so I think, you know, so in terms of being a student and embracing the chaos, you know, if you're a P4 and you're in the trenches and you're, you know, on a rotation in the ICU, talking about what you're doing, that's critical. And I think as a pharmacist, the most important thing is to talk about what pharmacists do. Nobody really knows what pharmacists are doing, especially in, you know, in a critical care ICU. When I say that I did a rotation, I did an ICU rotation at UIC when I was a P4, and people are like, oh, I didn't know a pharmacist rotates with the physicians and, you know, on the floor. And so I think putting that out there, I wish I had social media at the time. I would have taken pictures every single day to let people know, like, hey, I'm standing here. I am a PharmD, you know, on this floor, or I'm a pharmacy student on the floor. And I think getting the word out there is really important. You know, whether you're a P4 or you're, you know, in your P1, P2, P3 year, at any point that, you know, I think that's important. You can also, you guys are, I mean, right before you take your NAPLEX, I would say that you guys are brilliant. I mean, you know everything. So, you know, promoting any healthcare knowledge you have is also important compared to somebody who's been out there practicing for 10, 15, 20 years. Your knowledge is much sharper, you know, in terms of academically, you know. So clinical experience comes with the years and all of that. But I think, you know, putting anything out there that you've just learned and, you know, as a student, it's amazing how much knowledge you have and what you can put out there. And I think you'll also attract people. Tagging other pharmacists is important. So, you know, getting the attention of other pharmacists who have a larger following is my third piece of advice. So, you know, tag me if you want, and then I can reshare what you did, you know, things like that. because I think that's the only way that we can help each other as a profession. If you're looking to grow your presence on social, that, you know, being real and then working with other pharmacists and trying to get the word out there about what you do and what we do as a profession, especially during this pandemic. I mean, people aren't even aware that pharmacists initially, you know, we talk about this in Pharmacist Moms group, that the pharmacists working in community setting are at risk. You know, they'll say, oh, well, I didn't realize the pharmacist is at risk. But I'm like, yeah, well, the sick person is going there to get their medication. But we need to make people aware of that. Like, hey, this is where patients are coming. This is the first place patients are, you know, bringing their prescription. And so I think we have to do a better job at that. And I think all of you guys can, because I think students, it's ingrained in them. They've already been using social. So they're much more comfortable than, you know, someone who's going to start that not as comfortable with social media.
Mm-hmm. Thank you for that. And then if there's any questions from the audience, please feel free to kind of type those in right now as we're sort of starting to wrap up. But that was our last question. We just wanted to thank everybody for joining us, and then thank you, Dr. Soliman, so much. You know, it's great to see, you know, you advocating so much for the profession, and you know, having this opportunity, taking the best that we can out of this COVID pandemic and really utilizing that to highlight pharmacists. You know, it's great to hear that
No,
you know,
thank you.
stuff can come out of this too.
Thank you. Thanks so much. No, I appreciate this. And then let me know when this is all recorded too. I'd love to share this interview.
Sounds good. Well, with that, I don't see any questions. So again, thank you so much, Dr. Soliman. Thank you for taking the time to join us today.
Thank you. Take care.
Thank you.
Bye-bye.
Bye.